Hello, everyone. Please let me know if you can hear me well. One of the things that I can't do. All right, excellent. Thanks for joining, Luke. Well, as I mentioned yesterday, I wanted to do this AMA. It's been a couple of weeks since we did an AMA. I've been working on some things. The last AMA we spoke about the art financing that we got, and one of the main things that we wanted to get done is getting our Reg A approved, our filing approved, which just happened. Um, what does this mean? It means that we can now proceed and uh, start executing or basically sign the contracts that we've been working on. I've mentioned that we were working on a contract with the Red Cross. Uh, we can proceed with that, and we can also start acquiring the remaining shareholders to meet the uh, increase our shareholder base and qualify for a Nasdaq listing. So it's really a huge milestone for us to have this approved, because now it puts us on, let's say, the last stage before doing our S1 filing. Um, and it's really significant. So the the next steps after this are the execution of the contracts that we have been working on, the launch of the services, and the marketing and PR campaigns. Um, as some of you may have seen, there was some articles that came out a couple or a few weeks ago. There's some big announcements that we're having come out now. Um, now being a public reporting company, um, as a public company, we have to be very careful with our forward statements and things that can be uh, where you can calculate, potential revenues and things like that. So all I can say is that uh, I've talked about previously of the implications of having a contract with the Red Cross. Um, I've talked about our plans to do our to develop a cancer drug. Um, I've talked about the launch, obviously, everything that we had planned. That we just did a new update to our doctors app today. It was published today, and the apps are essentially ready to be launched. Um, we just needed to wait on these approvals or this approval to come in. Um, we're going to be sending a link out to everyone with, now that it's been approved, our 1A filing has been approved. We're going to send a link out to everyone with 3 different packages for shares, um, $20, $40, and $60 packages. And if people are still interested in buying shares right now, with larger amounts, we can do a convertible note, and we can also offer an additional incentive with free trading shares from our 1A. So um, that is all starting today. I actually have calls lined up. I already had a call this morning with the team from the Red Cross, um, and we plan to finalize that agreement before the day ends today, post it, and we'll be announcing, as we start wrapping these contracts up. Um, there'll be announcements coming out of different things, but essentially it's a very, very positive thing for us right now, having the 1A approved. It's been a huge, long process, but we got it done. And this really, I see it as a very positive thing for the company, because it not only makes us accountable for what we have to do next, but it's also, I think, the best format to pursue uh, our plans to adding a crypto economy to our services and showcase the benefits of that uh, in a transparent way. So this also means that we can now pursue the institutional funding that I've talked about in the past and wrap those deals up. We had non-binding term sheets, and there was discussions that we had made um, that were in reference to reaching certain milestones, and the main milestone in order for us to proceed to that next stage was getting our filing approved. Since it was just approved, we were very persistent with our responses to the SEC and everything. I think we did an amazing job. The team did a really great job with everything, getting everything done. Took us a little while longer than we expected it to be, as I'm always ambitious on timing, but I can also say that this was also a huge amount of work to get done, and it was a huge learning curve that I went through, and several people on the team as well, to get a public company audit done and to prepare everything, the business plan and all the partnerships that are needed to proceed. What lies ahead of us next is um, we're going to be signing these new agreements, and we're launching our services. Right now, the only thing that we're there's really nothing else that we're currently waiting on except just to get this done. I think it's good timing. I know this is flu season. The winter season's always good timing, and we still have some time left for the winter season. It essentially just started, so it's a good time for us to launch. And I think there's a lot of positivity in the crypto space as well because of Bitcoin's price going up. So that kind of, I think it's a positive moment for us to really start promoting everything and marketing much more than we have in these past months. Despite the fact that articles have come out, there's been great response from those articles. They they've put us in a place where there's attention drawn to what we're doing. People from different healthcare companies have reached out to me on LinkedIn and have tried to reach me directly, wanting to do partnerships and different things. And it's also a good thing for the LifeChain Foundation, because I think that'll give us a leeway towards bringing in other healthcare companies into the LifeChain's model, so we can hash data transactions. Basically, thinking about it more from a fundamental level, the major changes are not really. We're still pursuing free basic healthcare. We're still using blockchain to hash everything. The crypto economy is still a very important aspect of what we want to do, and it'll provide us with additional, resources to keep on growing free basic healthcare. But we needed to have a business model that made sense, and that is through having a marketplace and selling products, because there's no doubt that people love the service. So we're ready to launch. We're ready to launch our services and the apps and get everything going. So I think it's good timing as well for people to come in. We're going to be raising the price of the shares at the. Can everyone hear me? I don't know if you can hear me. Please confirm if you can hear me. I think. Can you guys write in the chat group if you can hear me? Okay, excellent. Okay, thank you, Quentin. So it's right now, I think it's good timing for us, despite the delays that we've had. But we definitely have good timing right now to get this done. Getting the 1A approved was, I've been waiting for that. The whole team has been waiting for that. It's it makes a big difference in how we can go about things now. We can go ahead and promote openly without any restrictions, and that's makes a huge difference in our planning. It makes a huge difference on what we can sign as far as agreements, what kind of partnerships we can do. Um, because from here on out, it's essentially growth, growth phase. So essentially, we now are able to uh, do the big things that we wanted to do, and do it in a way that leads us to a very positive listing. We still have yet to cover the amount of shareholders needed, so that's something that one of the things that I'll ask the community for help uh, so we can get that done. But I think it's it's a very valuable proposition, um, especially after everything that we put together. I mean, this past year has been a huge amount of work with doing everything, preparing us to grow as a public company. So I'll go ahead and I'm going to keep this AMA short. There's a lot of things that have to be done today, but I'll go ahead and see if there's any questions from the community. I'm going to scroll through the chat, see if there's any particular thing. Um, I'm seeing Green's comment here. Yes, this enables us to proceed with the S1 filing. That is correct. And that is significant because what we've done now is essentially, I would say 80% of an S1. What we're going to add to it next are the agreements that we have signed. By the time we do the S1, we're going to have those agreements in place, and obviously new funding from our institutional investors that we've been working with, locking that in. All of those things will be disclosed in our next filing, and it'll be in the S1, and that'll lead us to listing. So that's pretty much what we have to do next. And these are just steps in the process that we had to fulfill, that we had to get completed. Let's see. How do you propose hashing services using MTC without a subnet? Well, a subnet is still an option. Really, Daniel and I have talked about this, and so Patrick and I have talked about this, and the LifeChain Foundation. I mean, it's very important for everyone to understand that the LifeChain Foundation, everything that pertains to MTC will be run through the LifeChain Foundation. Now, there's not a technical need to have a subnet for hashing, but it's beneficial if we want to add additional services and keep it kind of isolated. And that was a plan to do it with Avalanche originally, because they were offering us a subnet, and that's still on the table. That's still something we can go ahead and do. It's still, since we originally made the plan for the subnet on Avalanche, there's been new things that have come up. Daniel showed me a proposal for using the Bitcoin blockchain to register transactions that are non-traditional transactions using blocks. Very interesting new concept that's out there in the build. I think it's in early stages, but some people would say that it's the most trusted blockchain. The Bitcoin blockchain is the most decentralized one. That some people consider it some of the most decentralized ones. So So basically, it's still an option on the table, but it's a decision that we'll be making in short time, uh, and it's a decision that it shouldn't have an impact that much on the actual amount of hashes that we do or our services in general. It'll mostly impact the type of if we decide to do smart contracts with DeFi, which is planned for the Lightchain Foundation. So those kinds of things that'll be impacted. Also, we have to consider the cost of it. It's having a subnet is more costly if we're just doing hashing. We have to have staking. We have to have nodes and things like that. But it's definitely still on the table, and it probably will become the next stage. Uh, Having a subnet. I mean, it's just overall, I think it's better to have the services in our own blockchain or subnet. Let's see. What about the funding for launching and marketing? Is that covered? The short answer to that is yes. The funding for that, I mentioned last time that I put my art collection up for financing. Um, what ended up happening there is I actually ended up getting 3 different buyers, and um, just a better deal, more funds, and a lower cost of capital for us. So uh, I think after everything that we've gone through, one of the most important things to consider is cost of capital. Um, sometimes a company can get offered financing, but sometimes the terms are just very aggressive, and it happens a lot in the VC space. Interests are very high, and these things are of detriment, especially when a company lists publicly. There's things that they call ratchets, and I was very keen to not have any ratchets for us for the health of the company because of all the experiences that we had with MTC. It can get crazy. People sell when they're not supposed to sell, or they said that they wouldn't sell, and things like that. In this case, because of that experience, we made it so it was as clean as possible, and we could have price stability, and that's how we built a strategy around our listing. So the cost of capital is important, and our funding is important, and it affects that directly. Uh, Getting art financing as opposed to selling the art, uh, they're 2 different paths, and one is more costly in regards to capital. So basically, it's the short answer is yes, we have it covered, and there's more to come. We've been working on talking to institutional investors, um, and that's what we're going to wrap up now. One of the main requirements for us to do this next stage was to have our filing approved, which just happened yesterday. So, um, in little words, I would say it's exactly where we need it to be for us to proceed to the next stage in regards to funding, and really everything else. I've pushed very hard to have the company in a position where we could launch and offer our services, but having our filing approved makes it much easier for us because we can openly sign agreements, and from this point forwards, as of yesterday actually, we can now pursue the contracts, sign them, and then uh, create more value for the company, and the right structure that we've always wanted to have. This is we're following the rules that need to be followed, and doing this as a public company required us to get to this next stage. Started with our filing. Now we got approved. Now we can go ahead and wrap up the contracts that we've been looking at and working on, and also funding. It gives us access to additional funding, uh, different financing options because we have a 1A approved. Um, you can see other companies have done similar things once they have a 1A approved and they're audited. then they can go out and be on these platforms that raise capital. We're not going to take the path of going onto a platform to raise capital. We don't need it, but it was something that institutional investors looked for uh, in order to offer us funding. So, like I had mentioned before, we had a non-binding term sheet signed with an institutional fund um, that backs us towards our listing. And one of the requirements that we had talked about was getting a 1A approved in order to pursue that and to come to an actual legally binding agreement. And so that's the next thing we're doing right now, which is extremely positive for us, and it'll give us enough funds to do everything that we wanted to do. It's been a long process, but it was necessary to go through these steps. Let's see. Would you look like would you like to look into targeting providers prior to launch? Definitely. That's a good question, Quentin. We're going to be targeting our three target users are healthcare professionals. That includes doctors, psychologists, and vets. Um, vendors, basically vendors for our marketplace. We need to target all those. And then finally, and the most important, is just the general population users. Um, I think it's important for us to target all types of age groups. There's benefits to all types of age groups. I talked about it. I think we were talking about it from a marketing standpoint, just to cover everything. And Jamie and I had a plan to use different celebrities for different targets to combine, uh, just to combine, just showcase use cases for different types of age groups. So there's a certain celebrity that has a big audience for people that are over 60 years old. There's different celebrities for different age groups, so we wanted to cover the whole spectrum of population. If you saw the article that came out a couple of weeks ago, it was in regards to the women's world and talked about target, the benefits for women. But really, our services being broad and primary care based really can attend to any type of individual. Whether you're healthy or not, whether you're young or old, um, anyone can benefit from basic healthcare needs, and that's where we wanted to target. Plus we also have the veterinary aspect, which in itself is enormous. The whole veterinary aspect alone can be, we believe it's going to be a multiple billion-dollar business down the road. So, in order to get to these next stages, we had to ensure that we had a plan to cover everything, to plan to cover all the targets that we wanted to get to. So definitely, yes, um, we're going to be needing to sign up more healthcare professionals in general. Our format is very different from what it was in the past. In the past, we hired doctors, the old doc.com. And this time around, it's different. We're basically connecting patients to healthcare professionals and not doing direct hires, uh, similar to what Uber does in a sense. Um, in that sense, it's kind of like a gig economy type of model. Um, it is different. Uh, it is different in some ways, but it is in a sense uh, the healthcare professionals are not employees of the company. And that's a big significant change in how we go about things. Even how they get paid is quite innovative in the space right now, especially in the US. We're using a third party payer, and it's something that we had to update in one of our amendments mentioned it, that we did recently before we got approved. Um, and that method is unique in the healthcare space. Other companies don't take that path um, because it doesn't really fit the traditional healthcare model. But our proposal is different in this case. We're providing free basic healthcare, so it has a goodwill aspect that's very different from other offerings that are out there, competitor offerings. I think it's because of pursuing our mission to provide free basic healthcare, it really has forced us into doing things in a different way. And I've always seen that as a huge advantage. to what we're doing and to the company. So definitely we're going to be pursuing through marketing and PR, acquiring new users, healthcare providers, and the other types of users that we're looking for. Launching will be expected in 2024, right? Well, uh, no, really. I mean, we have the apps ready to go already, as I've showed them. Um, it was just what was holding us up was getting the financing in place and getting our 1A approved. Now we can pursue the contracts that we have so we can actually launch faster. But um, we're going to determine that between today and Tuesday next week, if we can go ahead and launch as soon as possible before Christmas. So that's still on the table. That's still a plan. If there's a change to that, we'll let everyone know. There's still other things we have to wrap up right now. We still have to send out the links to for a 1A. We have to wrap up one of the contracts and do. But basically, we can start almost immediately uh, as long as those things are wrapped up today. It's just and a lot of things are kicked into action because of our approval. Let's see, looking at see if there's other comments here. Let's see, will there be marketing specific for MTC and the larger crypto community? Um, the answer to that is yes. The LifeTune Foundation will have their own marketing budget, but um, we have to showcase how Doc.com is using blockchain technology, and that is that's going to require some marketing and PR. Um, we usually have PR and marketing meetings on Tuesdays. This time we're actually having it on Monday morning because of our approval, and we're going to run through the whole plan. That we already have a plan in place, but now there's additional things that are coming into the mix, like the contracts that we have that we've been working on to sign, um, and those types of announcements that are coming up. You know, those press releases and things like that. So that's we're going to run through the whole plan on Monday and set a date. Thank you, Richard, for your congratulations. You know, I just want to I just want us to deliver. You know, I really, really want us to really deliver on all the promises and all the story and all our trajectory and our mission. I mean, that's the most important thing. Having a call with our lawyers this morning, they're saying, well, you know, this is going to be great, and you know, all the plan is in place, and we're ready to go. And I said, yeah, you know, I think giving the services and having people use them as they have used them in the past will always be the end benefits that we'll be able to showcase. And that's really where I want people to see people. I want people to see the benefits of free basic healthcare. And just our marketplace from that point on forward should grow. We're going to spend a lot on marketing and PR, obviously, but it should still it should have that element of organic growth because of the fact that we are offering free basic healthcare. It's more than just a method of acquiring users. It's really the mission of why we've done all this. I mean, I've mentioned it so many times, but right now it's time to deliver. And um, like I said, I really like the aspect that we're doing this as a public company because um, it's a good excuse to be strict for everyone, the whole team, including myself, with with the next steps that we have to do. So, we had in our financial model, we estimated. I'm looking at your question here, Richard. How many users are you estimating to visit the marketplace a week? Um, we always have to be careful with forward-looking statements that can have an impact on potential calculations of revenues. Like if I were to say, oh, we're going to have 10 users today, people could calculate that and use that as a projection. But let's just say that we definitely plan on getting to 1 million users uh, within the next 24 months. Um, it's hard to say how fast it'll ramp up. Financial models are built out and you calculate the potential users in them. We have to get to that goal. That is our goal. That is actually our goal that's built into our financial model. I believe we can reach it faster than that, honestly, because it becomes a function of how much you're spending on ads at some point, and their conversion rate. But the good thing about what we're doing is that our services are something that most people need at some point in their lives, and there's a constant need for it from certain parts of the population in any country. So we can always draw on users from there, and the speed of which we do that will be determined by how how great our conversion rate is based on our ad spending, and how much word of mouth effect we have. So I think I've never seen something like the plan that we built, something similar in the healthcare space. Um, it's just, I think it's really gonna, we have a goal of becoming a household name. And if you look at other marketplaces that have launched, I was doing an analysis recently of Jet. Jet was a marketplace that launched, and they did a huge ad spend in the beginning, and they got to pretty good revenues within the first year. And but they did spend quite a bit on marketing and PR. And they're just a traditional marketplace, a competitor for Amazon. Um, you know, our approach has always been mission based, and will always be optimizing to provide free basic healthcare. But optimizing the marketplace itself is extremely important. And there's lots of products out there that don't have the right kind of uh, attention on them, because they're kind of lost in the mix of all these other products. And that's where I think we're going to shine as well. The kind of curated process of products that we want to offer on Doc.com, and we want to have an extensive offering. And that's why it's important for us to add vendors. But the way we can showcase them and attach that to free basic healthcare, uh, you can highlight a lot of things that a lot of people still don't know about. Uh, even simple things like uh, vitamins and the importance of them, and how they are important to your health. And uh, there's different products in that space that are innovative, that are accompanied with blood tests and things like that. That there's just so many great things within the healthcare space that we can pursue, that can target healthy individuals as well. And I think our vision to for Doc.com is to be that place where you can go. It's You trust the services, you trust the transparency of them, and you trust the products that are sold on them, uh, as opposed to, I would say, an Amazon where you have just everything. It's there. Uh, so it's important for us to be that place where you can trust the start of your healthcare journey. A couple of years ago, you talked about data lakes. What do you contain? What is their status? Well, our data lakes uh, basically are all the data that we're taking in from users. What we're doing now is, I've actually reviewed recently some companies that offered our different AI services, but we're mostly doing this in-house. Um, what we plan on doing is predictive analysis. Uh, we're gearing towards doing analytics for public health, and for genomics in general. So predictive analysis for diagnosis. I'll give you an example for the Red Cross and hospitalization systems. They generate huge amounts of healthcare data. Now, that healthcare data will be used to train our AI models so we can develop uh, predictive analytics for different pathologies, things like that. And that also extends to many aspects of our telemedicine services. So the focus from the data, if you combine that with blockchain, I mean, I think we have such a just beautiful model because of the combination of these technologies. Uh, we're still taking in data. That's a fundamental aspect of our services. We're still putting that data into data lakes, which is just how everyone does it actually. And we're using that data to do predictive analytics for not only our telemedicine services, but also extending that into our hospitalization services. And that's the kind of products and services that we're going to be offering through organizations like the Red Cross to patients that go to the Red Cross. So the patients themselves are benefiting from the data analytics and genomic studies that we can do based on the data that was acquired from them directly. And that also allows us to create more products, and it gives us an advantage, a significant competitive advantage. So it's you add the crypto economy to that. You add the transactions uh, of the coin, basically, when we take in data, and it basically enhances the whole business model as well. And that's how we're presenting it, um, as a innovation and business model. It's not like a free for all. We have to do this very differently nowadays. But I also think it's much more beneficial. Uh, it's different from having a coin that's being traded on an exchange, and the demand from the hashing comes from there, but it has to be linked to something that gives it intrinsic value. And I've mentioned this for since our inception, basically. Uh, we have to showcase very transparently the intrinsic value of having a crypto economy. If not, then it puts us in a position like many other companies that just use crypto for reasons that are not even needed in most cases. But we're using them for the right reasons, and it is an innovation and business model that I think will be people don't perceive the significance of it now, but they will definitely. I mean, at least the community does. Obviously, that's why we're all here. Let's see. Do you have concerns about quantum computing? Can it break most forms of today's encryption that is used? For example, RIP Systemico. Actually, I don't really have concerns because you can also do quantum encryption. Um, there's other methods of dealing with quantum computing, breaking traditional encryptions. I still think we're not too far away, but I would say that's probably a few years away at least. Um, but I'm very excited about quantum computing because of the ability of quantum computing to process large amounts of data so fast. And that is very, very beneficial in cases just as ours. If we're generating large amounts of healthcare data and we want to process certain things, quantum computing can help on that. And it can also help. One of the main use cases of quantum computing, it's something that's very significant, is in the healthcare space. It's mostly for protein folding prediction. So proteins change. There's a great 60 Minutes episode that came out recently. If you see it, they actually talk about this here in that episode. Uh, Proteins are the building blocks of the body, and uh, they tell the cells what to do. Um, and we've always had an issue with determining how protein folds. Those use cases are directly involved in what we're planning to do. So to give you an example, if we have a patient come into the Red Cross and they came in, imagine this journey here. Patient uses our telemedicine service. Doctor determines that the patient needs to go to a hospital. Patient ends up going to a Red Cross hospital. Let's say that patient had issues and his legs are swollen. Doctor determines he could be of diabetics, so he now has to go get tested. Um, Goes to the hospital, gets tested. Turns out he's a diabetic. We take in those blood tests. We understand. We can do genomic sequencing, seeing if that person has certain predisposition, genetic predisposition to certain other ailments or pathologies. Um, but from a quantum computing level, you can also determine if that person has certain proteins uh, that are affecting that person's metabolism. And that's still down the road, but you can see how that could potentially lead to a solution for diabetes. The things. A lot of people try to don't understand the implications of how quantum computing can influence that, but I see it as a huge benefit. I mean, we're living in very interesting times right now. It's amazing the things that are happening. That's why for me, it's been just a constant internal tension to just get things done as fast as possible. And it has not been an easy road. I mean, but it's also been a very amazing road in many ways to learn all these things and to pursue this, and have it benefit the end goal and the mission. I see a world down the road where uh, people have access to free basic healthcare, and free basic healthcare is not just you received a free call with a doctor. That can extend to, oh, look, if you're diabetic, there's this new treatment that's out, and it's so low cost that, you know, fulfill these 2, 3 tasks, and you can receive a treatment and potentially cure your disease. That could be something that's not too far out, not 5, 10, 20 years out. Could be something that we could be doing, within these next 5 years. So it's definitely a very beautiful world if we take advantage of the technologies that are there in the right way. And it's incredible to think that we have things like blockchain technology and artificial intelligence to a certain level now that we can combine those things and create a true healthcare utility. And that's what I want Dr. to be perceived as, a true healthcare utility where we can to all the layers higher than the system, because it's so transparent, um, and just see it as a standalone model that really its service, its product offerings, its transparency, and its business and scale. So that's very important. It's very important for people who are shareholders. It's very important for people who are even holding MTC. It affects everything. But no one's really combined these things into one. And now's the time to do it. Now is the time to do it. We're post-pandemic now. There's so many examples of things that need to be done, that we went through, that we learned from the pandemic. I did a podcast recently. It'll come out in the beginning of January. It's called the Definitively Speaking podcast. It's very big in the healthcare space. And I touch on a couple of topics there in regards to what is free basic healthcare and what does that mean down the road. And it really is something that can be expanded into many other things. So us having that mission and combining these technologies, using them in the right way, can lead to many other forms of free basic healthcare. And we're starting off with something that's already very beneficial to people, just to give them access to this, to healthcare professionals. That alone is, I would say, in its most basic form, the purest form of help you can give someone. But uh, because of the aspect of the blockchain component and the crypto economy and everything related to data, um, people always say, oh, nothing is truly free. Well, I guess that's true because, in our case, we're giving free consultations, but we are taking in data. And I see nothing wrong with that. I mean, there has to be some sort of exchange that makes it beneficial for both parties. But the important aspect is that uh, we can we can we can offer services that are of no cost to the user that are down the road are not only telemedicine, that are also, potentially genomics testing, and develop products that generate income for the company based on that, but in the end are no cost to the user. Maybe, uh, other things that are beneficial for the creation of genomics products or analytics for diagnosis and things like that. So that's the path that we're taking. Um, I think it's very important for everyone to understand, the building blocks to get to this point. We've gone through a pretty amazing trajectory of ups and downs and lots of experiences and lots of people getting our services and learning a lot from that. But we had to have the model locked in. We had to have a great team, which we have now. We had to have a funding locked in, and we had to combine these technologies and have the tech side of things really, really well mapped out. And that's what we have now. We have all of this, and not only do we have this, we have it done and consolidated in a way that's public. Because ultimately, the best thing for Don.com down the road is not for, you know, it's great being a company of great value. I think that's really, really positive for shareholders. But ultimately, if we become that true healthcare utility that I'm talking about, uh, it'll be something that lasts much longer than our lives. And that's really the intention is to become that and to be not dependent on governments or institutions, to be a standalone, truly good model that's transparent for the world, that uses blockchain for transparency, that's accountable, and it's providing a scientifically pure service in that sense. So, I'm very I can't believe this. I'm 40 years old, and it's been a long road, but it's I started on this mission nearly 12 years ago, 11 and a half years ago, when it became my life goal. And now we have now been approved by the SEC. Um, we have very, very amazing contracts and partnerships right ahead of us. Uh, Enough funding from different sources, access to enough funding from different sources to really do what we need to do and fulfill the mission and pursue and create a lot of value for shareholders and make the mission a reality. Oh, can you tell me if you can still hear me? You should be able to. Where can we access the podcast? The podcast has not been up yet. I already did the podcast, but it'll be published. It's called the Definitively Speaking podcast, and they're syndicated. They have an audience of the millions, and it's one of the largest podcasts in the healthcare space. I'm doing others as well. A lot of these things are going to start ramping up more. Um, but right now it's that's the one that I just did recently. I touched on these subjects, and when I talked about free basic healthcare, I talked about the blockchain component, the transparency, and the benefits of AI, and how we plan on doing these things. Some of it, not giving everything away, but basically the main topics that's heard a lot by healthcare leaders in the U.S. And also politicians. A lot of people hear that podcast. They have a pretty unique audience in the healthcare space. So it's going to be out, I believe, the 19th of January, or the 9th of January, beginning of January. It'll be out. So I'm going to wrap up this AMA. We'll be sharing the links to the 1A for the packages. Please, if you have friends and family that are interested in supporting our cause and our mission and believe in what we're doing, they can buy packages of $20, $40, and $60. Those are free trading shares. That means that the day they're listed, they're free trading. There's no restrictions. If you compare it to the convertible notes that we put out, they have a 1-year lockup period or a 2-year lockup period, whichever one you choose. But these packages are free trading, and we have to increase our shareholder base as much as possible in these next couple of weeks. So we'll be sharing with them, and we have to reach and surpass our 300 shareholder target. But we've done this in a very, I think, very smart way to be strategic and to ensure that we have price stability as much as possible. Obviously, we don't know what can happen. No one knows the future, but we did it very, as cautious as possible so we can have a great success and have access to the funding and growth that we need to have. So I'll do one more questions. If there's any additional questions that want to be signed or want to be posted. Let's see. I just read a question here by Green. Services in Mexico begin after Red Cross contract. No, actually, they're well, we plan on launching the services wherever we can as fast as possible, but they're probably going to be launched before the Red Cross contract puts into effect. So the Red Cross contract that we've been working on basically is more related to offering the user base from the Red Cross our services that should be launched before we start with the Red Cross. And secondly, the creation of a whole bunch of AI derived products and services that we'll be creating along with the Red Cross for genomics, predictive analytics for diagnosis, and the identifying of any other tools that we can create with AI, for example, cataract detection, things like that. So we have a long list of things. And scrolling through to see if I see any other questions here. Sorry if I talked quietly today. I'm in a workspace right now. There's some other people here, but I appreciate everyone. Thank you so much as usual for being here and for participating and for giving us great feedback. I say from the heart, I'm very, very grateful for everyone being here. I think we have a great path ahead of us, and there's a lot of work that's been put into this, and we've been just getting through everything, getting through the delays and the filings and the audits and the builds on the apps. We still have yet to launch the new website with the marketplace. So everything that you see in the apps will be on the website as well, along with our new AI chatbot. There's going to be a new one as well, updated one. So there's a lot of great things coming up, and we're going to be wrapping these things up. And I'm definitely going to do another AMA next Friday, and then we'll start probably adding other people to the AMAs as well. We had Jamie on one of the previous AMAs, and I think we'll probably have other individuals that it's a surprise, but it'll be good. I'm kind of also in a mindset now that we have to consider that we have to be very careful with how we go about announcing things, especially as a public company. But I think we're on a really great path, and what I've already said and what the community already knows, uh, that's what we have to execute upon now. So thank you, everyone. I hope everyone has an amazing weekend. Enjoy the holidays with your families and friends, and be safe and stay healthy. And I wish everyone an excellent weekend. Thank you so much for being here. Um, let's see. Oh, last question here. Um, is there possible to launch this month before Christmas? Yes, that's a possibility, and I'm pushing forward for that to happen. So we will definitely push for that. Thank you, everyone. Have a great weekend.